So this morning I'm talking to Tara Lawson, who's our women's health physio, and because it's not just about leaky bladders, I thought it'd be of interest to you to learn what else a women's health physio does. So what else is women's health, Tara?
Okay, so like you said, not just leaky bladders, although that is a big part of what we cover, so stress and urge incontinence. We also cover pelvic girdle pain, so any pain around the pelvis and can come up through the low back. Symphasis Dysfunction, so particularly in pregnant women, and also things like prolapses, so prolapses of the bladder or the rectum into the vaginal canal. Lower grading ones we can treat quite successfully.
How are they likely to have occurred?
Childbirth, age, abdominal surgery, they're quite common risk factors. Also chronic constipation or trouble with your bowels can lead to increased risk.
So how can physiotherapy help these conditions?
First things first, lots of advice, show you how to move properly, how to open your bowels correctly. We can also use things like manual techniques to release off any tight muscles and help restore coordination between the bladder, the pelvic floor, and all the other muscles around the pelvis to help reduce pain or reduce urinary symptoms. And we'll also do a lot of exercise as well, so you can manage them at home.
And what I would imagine a lot of people are quite embarrassed about coming for a treatment. So what would you say to them in terms of what actually happens in the treatment?
Okay, so with an examination, we would normally, with your consent, obviously do an external and internal vaginal assessment, but only if it's clinically indicated, and I will explain to you my reasonings behind it. You don't have to participate in the examination if you really don't want to, but obviously we would recommend it as part of accurate assessment and treatment. And
of course all the treatment rooms here are very private, aren't they?
Yes, they are.
Soundproofed and everything else, aren't they?
Yeah. So it might be a little bit uncomfortable, but
And what sort of results do you get from coming to see a women's health physio?
So normally we're expecting results within the first couple of weeks. So not complete resolution of problems, but some changes, some positive changes within the first couple of weeks, and it'll make a big difference to your life. A lot of people have now accepted that it's normal to have some leaking or to have some pain as part of childbirth and aging. But a lot of these problems can actually be resolved, and you don't have to suffer with them. It's quite simple treatment, and it gives you a lot of quality of life back.
Yeah, so thanks very much for that. So you don't have to suffer with leaky bladders or prolapses, etc. If you'd like to book an appointment, just call the clinic and ask specifically to see women's health physio or book with Tara Lawson, as she is our women's health physio.